tell us, what threat or opportunity should health IT leaders be keeping their eye on?
I think there's a really interesting dynamic emerging around price transparency. There's bipartisan support, motivated regulatory actions, as well as a groundswell of patient activism and entrepreneurial companies who are really tapping into the theme around price transparency. There's new regulations coming up on July 1 that health IT leaders should really be aware of, where hospitals are required to publish machine-readable files in a specific format with new data fields. So IT leaders will have to think about whether their existing vendors or internal capacities are up to the mark, or they need to actually leverage other resources. I think alongside with some of these regulations, there are new requirements around good faith estimates, advanced EOBs, which will really make it an operational challenge to manage all of this complexity. And so that's an area that I would really encourage IT leaders to look into.
So let's start with threat. There is a lot of money flowing into AI. So there's a lot of compute power that's being built. I mean, you could look at NVIDIA's stock price and its growth just to underscore that point. So I think the industry, with all that money flow, has a lot of pressure on it to onboard some of these new AI capabilities. So I'm concerned about that particularly in a healthcare domain, which is very high stakes, that's done safely and effectively. So for health IT leaders, I think there's certainly opportunity there, but there's also a threat to make sure that we're not jumping the gun to onboard things that perhaps aren't ready for prime time and for use in that clinical domain. On the opportunity side, I think the issue is that there's a lot of challenges in healthcare, and AI might be a tool to help solve some of those challenges. So, quality and safety of care, and rationalizing the costs of care and access to care for it, and of course, professional burnout now. So I think one of the things, if I could empower health IT leaders to do, is to think about the business models supporting that. So AI can be part of the solution set, but finding supporting business models is required for any of these things to be on board to solve some of these really challenging problems in health services delivery.
Well, I think it tracks to the announcement that we made this morning. The partnership with Humana is really about staying ahead of where the regulation from CMS and state Medicaid agencies are going around provider directory accuracy and ensuring that patients can get information about where to see an in-network care provider easily. We agree with Humana's stance that it's really about member experience. We need to go beyond regulation. And I think you're going to see states like California and Illinois starting to be more stringent in their requirements around provider directory accuracy. And so we're excited as a company to be out in front of that trend.
Yeah, I think a couple that come to mind. The first one is the way people engage with health broadly defined is dramatically changing. The average person only visits their traditional healthcare provider less than 2 times per year, but people engage with health and wellness solutions all the time. There's a bunch of actors in the space who are now looking at that as an opportunity to establish that relationship with the customer, with the consumer. We think that healthcare providers really ought to be the hub of that experience. We think that having that engagement is going to be critical to their success, and we hope we've got a platform that's going to help them do that.
Yeah, I think health IT leaders really need to think about the healthcare industry and how we're going to embrace innovation and solving the workforce shortages within the nursing strategies itself. I think having an on-demand platform like ShiftMed that allows them the flexibility within the healthcare community, so these individuals from the healthcare professionals can pick up shifts as flexible as they can.
Absolutely. Everyone's really excited about AI, as they should be. But I think we're so optimistic and so excited about how it can solve things that it's hard to look forward to what new problems that could really make. And I think even where panels have really tried to talk about the perils of AI, it's really hard to have that conversation. And also think beyond healthcare. Healthcare is such a leader in technology, which is fabulous. But then thinking about how some of that technology could be misused or proliferated within society and potentially harmful. So even though we're really excited, I think we have to bring some of our brilliant minds and really think about worst case scenarios. And maybe that's the attorney in me, where we kind of see worst case scenario.
Yeah, so without a doubt, healthcare worker burnout. We at RICO have been championing this mantra of what we call caring for those who care for us. Clinician shortage in terms of clinicians needed versus supplied. That delta has never been bigger. And by many accounts, by 2034, that's going to grow to over 100,000 gap in clinicians that are needed. In addition, you have nurses and other extended care staff leaving healthcare in record numbers. There was one survey that was done in 2023 and included over 18,000 nurses. And the hypothesis of it was that as many as 1/3 of active nurses in the United States will have successfully made a career change within the year ahead. So leaving in record numbers. And what we'd like to do at Rico is really help our customers adopt a mindset of adopting technology to solve their problems versus just more people. Automation across the workflow and the experience allows the people that you do have to be more stimulated, to spend more time with patients, to be more efficient, and then lessen your reliance in the future for additional FTEs, for additional care staff. So that's absolutely our focus. And the time is now to act and start getting ahead of it.
Yeah, I think the threats are still in the financial area. I think there's a lot of pressures for efficiencies and cost reductions. I think hospitals are still coming out of the COVID years where revenues are down, and so they're having to do less with more. So I think that's always going to be a threat until we get out of this macro environment that we're in, unfortunately.
I think they need to keep an eye on their outdated infrastructure and networks. We see it all the time. They want to bring in all this new, innovative, emerging technology. Well, they have very outdated old infrastructure that can't support all this new, great technology they want to bring in. And I've actually seen it, and it has impacted the staff experience, the patient experience, because it's just not great. And you have to have that technology be supported. And I think if they keep trying to bring in more technology without addressing that foundational problem, the experience is just not going to be great for anyone.
Glad you asked. I think one of the biggest opportunities that is a little undervalued right now are the IT investments and interoperability that have been coming more frequently in the last couple of years. So whether we're talking about provider API, the patient access API, payer-to-payer, and now prior authorization requirements that are coming through policy, a lot of those investments are being viewed as IT-owned investments and as kind of a check-the-box exercise. But I think there's a huge opportunity. A lot of the business leaders in these organizations don't even know that those capabilities are being developed or how valuable they could be to them. And a lot of those investments aren't necessarily independent investments. They're actually cumulative, to invest in mapping your data and building the capability to exchange it in a standard way to serve lots of use cases. So I think there's a big opportunity to move those interoperability investments from the IT shop as a business initiative or strategic initiative.
Yeah, great question. I think the biggest threat and opportunity is definitely this fragmentation. There's so many new folks coming into healthcare, but what's that really going to mean for the consumer experience? In some ways, there's a huge opportunity for consumers to be stewards of their own data, own all of that data, and really take it from provider to provider. Huge threat, though, that that data starts to get messy, not shared properly, not linked correctly. So that's really what we're watching.
Yeah, the biggest threat in healthcare with AI is the hype. So there's so much going on that our joint customers can have a tendency to turn it all off because there's so much hype and so much noise. So really figuring out, all right, what should we be focusing on? There's tremendous pressure in the healthcare industry on cost. There's tremendous problems in staffing and being able to then use AI to be able to offset the issues of staffing and cost as a very practical matter. So what's really not being discussed is how you take all the researchy type AI and really focus it on practical problems.
Yeah, so one thing we're seeing a lot of is basically shadow IT, so tools that are not approved by organizations being used at really the coal face. So like, busy surgeons, busy docs working in a really busy hospital, choosing tools on their own. So WhatsApp, iMessage, text messaging happens all the time, and obviously this is a threat for patient privacy. And it can also be seen as an opportunity. So we know clinicians are using these tools which are easy and make their lives easier to communicate. But I think if you can find a way to formalize that, and this is what we do at Sela in terms of providing them a secure alternative that's easy to use, it can really empower clinicians to do the same thing they're doing already, but in a formalized way that's controlled.
Well, I'm an optimistic person, so I'm going to go with opportunity. In our survey for the first time this year, we also asked about AI. So AI obviously now is front and center with the invention of generative AI. And we felt the need to ask physicians, how do you actually feel about AI? Do you think there's a potential for things to improve, for your workload to decrease, for patient care to improve? And by and large, physicians felt pretty optimistic about the potential of AI. About 83% of physicians stated that yes, they do feel there's potential. Now, I will say that there was also significant skepticism. So more than half of physicians thought, well, it could just be yet another thing that we have to deal with as far as technology solutions. And then over 60% of physicians were really worried about the loss of human touch with the invention of AI. So what can we do about this as a technology company, as a healthcare system? I think it's super important that we involve physicians from day one in any development of AI to make sure it's really clinician facing and it helps to improve patient care and reduce the burden, the administrative burdens physicians are feeling. And that's where I think we at Athena Health are uniquely positioned, to use innovative technology solutions to cure the significant complexity that exists in the healthcare system today and really enable our physicians, our practices to provide high quality, accessible, and most importantly, sustainable healthcare for all.
Yeah, one area that health IT leaders should be focusing on is both a threat or an opportunity, depending on how you respond. And a big part of that is how there's a set of healthcare enterprises that are really reinventing and using a technology-driven reinvention centered on a strong digital core. A strong digital core is cloud as the enabler, data as the driver, and AI as the differentiator, including generative AI. There's a set of organizations that are kind of leading with that reinvention, centered on those elements, that are really starting to drive improvement on how they finance care, deliver care, and create new services for consumers.
I think healthcare IT leadership realize that technology has not been kind to nursing over the years. And having nurses at the table to address a lot of the challenges and bring in their own expertise to address a lot of the things that are considered to be their pain points that have been long stemming and almost in the place of being wicked problems is the answer for us to get through a lot of the issues that we've been facing, particularly as it relates to nurses' well-being and their willingness to stay in the arena where patients need them the most.
Awesome. Thanks, Katie.
Thank you.